Hi, I'm Dr Angeline Yong, the Senior Consultant Dermatologist at Angeline Yong Dermatology. Today I'll be talking to you about scalp care and treatment, largely tackling issues like scalp dermatitis and hair loss using our signature treatments, which include low-level laser therapy with the Revage 670 and some scalp cleansing rituals that we utilize for patients with very scaly, oily, greasy scalp. LLT using the Revage 670 is a treatment that's really useful for certain types of hair loss. So I use it to stabilize hair loss, to stop shedding, increase hair regrowth, and also to improve patients who complain about hair thinning issues. So when a patient walks in and sees me for a hair loss consult or a scalp consult, I usually have to look at both the hair as well as the scalp condition. This is why it's important to understand that hair growth is also affected by the health of the scalp. Fundamentally, it's like growing trees out of poor soil. So if you have very poor soil to begin with, like the soil is either dry and really lacks water, the trees are not going to grow well. So likewise, your hair fibers are not going to grow well. So when I look at a patient from the hair perspective, the scalp health and the hair health go hand in hand. So if I ascertain that the patient primarily has a scalp issue, and what are the common scalp issues we face? Scalp irritation or scalp dermatitis can come in the form of seborrheic dermatitis, which is an oily, greasy scalp condition that is quite common. Not only can it affect the scalp, it can also affect sort of the folds around the nose area, around the glabella area, which is around this part of the brow, the back of the ears as well. Patients who've got eczema elsewhere can also have eczema affecting the scalp. These are all patients that will benefit from some form of scalp treatment, either to degrease, remove flakes, or to improve the general health of the scalp itself. So for patients that experience various types of hair loss, I first have to ascertain what type of hair loss they're experiencing. So I typically will classify hair loss under either scarring or non-scarring type of hair loss. So after I've done a thorough history, gone through the medical examination, and more or less have an idea of the type of hair loss that they're experiencing, I may find that some of these patients might benefit from going through low-level laser therapy, such as the Revage 670 that we do in office. The types of hair loss that are really suitable for this treatment classically include pattern baldness. So female and male pattern hair loss can absolutely benefit from the Revage 670 treatment. Patients who experience like shedding from telogen effluvium can also benefit from using low-level laser therapy like the Revage 670. Patients who've got other sort of hair loss issues, concomitantly also having sort of issues like my hair's thinning, I feel that my hair is unhealthy, they might also benefit from utilizing LLT in this instance. Depending on the severity as well as the lifestyle of the patient, I would recommend either starting on in-office treatments and then weaning down the frequency as the condition gets better, or converting to a home-based device when things actually settle down. Alternatively, the patient is unable to do in-office treatments. Sometimes home-based therapies with take-home LLT devices can also be utilized. Now, the reason why I like to utilize the LLT, the Revage 670 in office, is largely because of the efficacy of the device. Just like in office versus home-based LED treatments that we use for either wound healing or we use for rejuvenation, indefinitely the office-based devices have a greater efficacy because of the sort of platform being more optimized with regards to the energy and the fluence, the settings. It's a very easy device to go through. There's no pain whatsoever. It's a very cool treatment. When they come into the office, it's just like going to a hair salon and having your hair treated. And then this big device is basically placed and lowered around the patient, around the head itself. And this device is a rotational laser treatment. So the reason why it is superior to home-based devices is that the coverage is better. It rotates around to ensure that all parts of the scalp actually receive the treatment, and it's also timed as well. I think it'd be good if optimally a patient could start off doing it 2 times a week for the first maybe 6 weeks. So that would be maybe about 12 treatment sessions. Then subsequently be tailed down to once a week treatment. Oftentimes, again, we work with the patient's lifestyle and the type of medication. For example, if I do a hair transplant case, I usually would tell patients that it would be good to partner this as well after the transplant to ensure that the transplanted grafts and the recipient side receive as best support as possible. So the reason why I would propose using it for maybe more than 16 treatment sessions to up to 30 will be for patients who mainly utilize this as a mainstay treatment along with their topicals as well. So that would probably be required in order to kickstart the hair growth process, as well as to increase the vascularity to the targeted areas and improve hair growth. When it comes to hair loss and hair disorders, it is a very long process. Nothing grows overnight. So I always tell patients that when we're dealing with hair, we really have to deal with it over a longer period of time. So we're looking at usually months to see efficacy. There are various forms of treatment that we utilize. For example, if we use something like the Keravive scalp treatment, the process would involve basically a step where we would actually use a mouth peel to sort of exfoliate the scalp. It's sort of like a very, very gentle peel or exfoliation process using a device to basically mechanically clear out the gunk. And then you actually can really see it sort of in the cylinder how much residue that has been extracted. So after the scalp is really cleansed through, row by row, we part the hairs and we clean row by row to ensure that we cover the entire scalp. We move on to actually infuse peptides as well that can help to stimulate hair growth and improve the scalp health. So that's the second step, which involves rehydrating the scalp with nourishing ingredients. And after that, we follow up with a bit of a scalp massage to sort of massage the product in so that it improves the circulation as well in that area. And for that treatment that we utilize, there's also a take-home follow-up peptide solution that patients would use. So there are many ways to do this, but oftentimes it's important to first ascertain what type of scalp condition the patient has and whether they're suitable for one over the other. Right, so if you actually complain about dandruff, then it's very important to really see a properly trained specialist who actually knows what they're dealing with, because fundamentally, flaking can mean a lot of things. So the flaking can be due to a common condition, seborrheic dermatitis, where you get oily, big, greasy flakes. And then the treatment might be different. The types of shampoos that you use and the sort of like treatments that we recommend will be more to degrease the scalp and to clear out the oiliness. On the other hand, you could also have very fine dandruff scales, and they're very, very different in etiology. Basically, that might mean that you have basically condition like scalp eczema. So when you do a microscopic examination, you will be able to see and distinguish between the two types. So all flakes are not the same. Now, that condition would then mean that you have irritable, itchy scalp condition that is typically dry. If you use harsh shampoos that basically treat dandruff and dry it out even further, it's only going to get worse. So patients that actually require a very soft shampoo, they require something that is really not chemical based, a very gentle shampoo to nourish and to prevent sort of the skin from drying out any further. And when you fix that and use some solutions to help to hydrate the scalp condition, it will get better because it's primarily like a dry, arid, harsh desert land. On the other hand, the flaking could be something more sinister as well. You could also be having an inflammatory scalp condition that can be causing scarring forms of hair loss. So like lichen planopilaris, for example, is a flaky scalp condition. They complain about scaling, about itch, and it's very different because you will find focal areas of scarring, focal areas of redness that could lead to scarring, and that has to be picked up very early. We do not pick up a condition like lichen planopilaris early, or LPP for short. It is basically going to cause permanent hair loss. Thank you for watching the above video. I'm Dr. Angeline Yong. If you'd like to find out more about looking after your skin, hair, and nails, don't forget to follow our page.